Hello and welcome to class. Today we are going to talk about infection control. Please review the following learning objectives. The most effective way to break the chain of infection is to wash your hands. Therefore, every procedure must begin and end with proper hand hygiene practices. This will help reduce the transmission of disease-causing organisms and lessen severity of disease. A disease is any sustained, harmful alteration of the normal structure, function, or metabolism of an organ or cell. There are carriers. A carrier is an uninfected person and can transmit infection to another person. The chain of infection has 6 links. It is important to know these 6 links in order. It starts with the infectious agent, then reservoir or host, a portal of exit, a mode of transmission, a portal of entry, and a susceptible host. In order for the chain of infection to be broken, you need to eliminate any one of these links. The smallest of all pathogens are viruses. Viruses are unresponsive to antibiotics because antibiotics are unable to destroy the viral invaders that enter a normal cell and multiply within the cell. Bacteria are tiny, simple cells that produce disease in a variety of ways. They're classified according to their shape or morphology. Pathogenic bacteria can secrete toxic substances that damage human tissue and act as parasites inside human cells or grow on body surfaces, disrupting normal human functions. Antibiotic resistance is one of the world's most significant public health problems. This is because when an antibiotic is used inappropriately, it can cause resistance to that strain. Protozoa are unicellular parasites that can replicate and multiply rapidly once inside a host. Some examples of diseases caused by protozoa are Giardia and malaria. And frequently, we see diseases caused by protozoa in areas of tropical climates. This is because there are high numbers of insects that can act as vectors. Fungi include such organisms as mushrooms, molds, and yeasts. And we see that fungi grow best in warm and moist environments. And the best treatment is to treat with antifungal agents. Rickettsia is a member of a group of microorganisms that, like viruses, require other living cells for growth, but like bacteria, use oxygen, have metabolic enzymes and cell walls, and are susceptible to antibiotics. Therefore, antibiotics can be used in the treatment of rickettsia. The second link in the chain of infection is the reservoirs. Reservoirs may be people, insects, animals, water, food, or contaminated instruments, and they gain entrance into a host or they will die. A reservoir host supplies nutrition for organisms, allowing that organism to multiply. A portal of exit is how the pathogen escapes reservoir hosts. Exits include mouth, nose, eyes, ears, intestines, urinary tract, reproductive tract, and open wounds. We will be learning and applying standard precautions. Standard precautions help to control the spread of infection and are very important to be followed at all times. Direct transmission occurs from contact with infected person or discharges from infected person. Indirect transmission occurs from droplets in air expelled by coughing, speaking, or sneezing, vectors that harbor pathogens, contaminated food or drink, or contact with contaminated objects called fomites. The fifth link in the chain of infection is the portal of entry, and this is how transmitted pathogens gain entry into new hosts. It can be by mouth, nose, eyes, intestine, urinary tract, reproductive system, or an open wound. When the body experiences trauma or is exposed to pathogens, protective mechanisms are altered and the body responds in a predictable manner. This is called the inflammatory response. Please look at figure 3-2 on page 49. Now let's look at the 4 types of infection. The first is acute infection. It has a rapid onset of symptoms, but lasts for a short time. The prodromal period is the time when the patient first shows vague, nonspecific symptoms of disease, and symptoms appear after the tissue damage begins. Chronic infection persists for a long time and sometimes even for life. Some chronic infections are asymptomatic, which means without symptoms, but the virus can still be transmitted. A latent infection can be persistent, and the symptoms can cycle through periods of relapse and remission. Some examples of this could be cold sores, genital herpes, and varicella virus. Opportunistic infections are caused by organisms that are not typically pathogenic, but occur in hosts with an impaired immune system response, such as individuals with HIV. Over time, this person's immune system becomes weakened, and diseases result that are not typically seen in a patient with a healthy immune system. Please review the following learning objectives for Lesson 3-2, Ocean Standards, Contamination, Procedures, CDC Regulations, and Sanitation. OSHA standards for healthcare setting. Universal precautions. All blood and certain body fluids must be treated as if known to be infectious for bloodborne pathogens. Precautions must be implemented for all patients, regardless of the information available about the person's individual health history. Please review this chart with potentially infectious fluids. Items contaminated with any of the following potentially infectious materials require special handling. Employees face significant health risks as the result of occupational exposure to blood and other potentially infectious materials that may contain HBV, the hepatitis C virus, or HIV. Employers whose workers are at risk for occupational exposure to blood and other infectious materials must implement an exposure control plan that details employee protection procedures. OSHA's Bloodborne Pathogen Standard, Needle Stick Safety and Prevention Act, requires that employers must keep a confidential Sharps inquiry log that describes the device involved and details of how and where an incident occurred. Parenteral exposure includes accidental needle sticks, occupational related human bites, and exposure of non-intact skin. After reviewing this CDC hand hygiene recommendation slide, you will understand our policy for keeping your nail tips no longer than 1/4 inch and not having any artificial nails or gel nails during any of the clinical classes. When the hands are visibly soiled, wash a minimum of 15 seconds with antimicrobial soap and warm running water. Alcohol hand rubs can be used in place of hand washing before and after contact with each patient and also after removing gloves. It's important, though, that after using alcohol hand rubs, you do throughout the day use the hand washing techniques of at least 15 seconds with antimicrobial soap and warm running water. Barrier protection, or PPE, includes specialized clothing or equipment that prevents the healthcare worker from coming into contact with blood or other potentially infectious material. These can include disposable gloves, face masks, face shields, protective glasses, shoe covers, laboratory coats, barrier gowns, mouthpieces, and resuscitation bags. We will go over this in further detail in class. Gloves must be worn when touching a patient's blood, body fluids, mucous membranes, or skin that is not intact, handling items and surfaces contaminated with blood or bodily fluids, when performing venipuncture, finger sticks, injections, and other vascular procedures, when assisting with any surgical procedures, when handling, processing, and disposing of all specimens of blood and any bodily fluids, and when cleaning and decontaminating spills of blood or any other bodily fluids. Please take the time to pay close attention to this safety alert. It is important when removing gloves to use the standard precautions procedure, because the goal is to minimize exposure to pathogens by aseptically removing and discarding contaminated gloves correctly. Environmental protection refers to minimizing risk of occupational injuries by isolating or removing any physical or mechanical health hazard in medical workplace. You can do this by following these procedures. The bloodborne pathogen standards require certain housekeeping measures to ensure a sanitary work area. Work surfaces must be immediately decontaminated with a disinfectant after accidental spills of blood or bodily fluids, at the end of each procedure, and at the end of each shift. Disinfection and decontamination of all reusable containers must be done on a routine basis, and sharps containers must be kept close in the work area. Never pick up spilled material or broken glassware with bare hands. Always wear gloves or other protective equipment during disposal, and handle soiled linens as little as possible. Contaminated materials and or infectious waste must be handled with extreme caution. The hepatitis B vaccine is an intramuscular injection and is given in 3 series doses. This must be available free of charge to all employees that are at risk of exposure to hepatitis B. If a worker is exposed to an accidental needle stick, a human bite, exposure to broken skin, or from a splash or splatter onto mucous membranes, such as the eyes, certain procedures must be followed. Please review the following 2 slides on the risk of infection after an occupational exposure and post-exposure management. Now let's look at aseptic techniques. First, let's break the word down. Asepsis. A means without, and sepsis is the presence in tissue of harmful bacteria and their toxins, typically through infection of a wound. So aseptic techniques means freedom from infection or infectious materials. Medical asepsis is the destruction of disease-causing organisms after they leave the body, and surgical asepsis is the destruction of organisms before they enter the body. The most effective barrier against infection is unbroken skin. When washing hands Wash correctly before and after every patient. Use warm water, antimicrobial soap, and friction. Alcohol-based hand rubs may substitute unless hands are visibly contaminated. Sanitation is the cleansing process that reduces numbers of microorganisms to a safe level. It removes debris such as blood and other bodily fluid from instruments and equipment. Wear gloves while performing sanitation. Did you know that sound waves can be used to sanitize instruments? This is ultrasonic sanitation. The instruments are placed in an ultrasonic bath of cleaner and water. Sound waves cause the solution to vibrate, which loosens the materials attached to the instrument. The process is gentle on instruments and reduces workers' exposure to sharps injuries. Disinfection is the process of killing pathogenic organisms or of rendering them inactive. Disinfecting agents vary in effectiveness and must be used according to instructions. There are several common errors in disinfection, and it's important to know these common errors in order to avoid. Please review the following list. Sterilization is the destruction of all microorganisms. It's essential for surgical asepsis. Areas should be set aside in each office for sterilization. Clear, clean plastic bags in which to store sterile packs may be kept in the sterile area. After reading this chapter and reviewing this PowerPoint, do you know the difference between sanitation, disinfection, and sterilization? This is very important to know, and we will discuss further in our class meeting. So what is your role as a medical assistant? The spread of pathogens can be controlled only through application of bloodborne pathogen standards and by proper sanitation, disinfection, and sterilization of supplies, equipment, and work surfaces. It is your role as a medical assistant to make sure that these processes are followed. A large part of our role as a medical assistant is to provide patient education. You can provide patient education on asepsis in the following ways. While washing your hands, you can explain to the patient that it's routine and is part of daily hygiene. Advise the patient to carry an alcohol-based hand rub and use it throughout the day. Explain to them the use of disposable tissues or bent elbow to cover nose and mouth when coughing or sneezing. You can discuss proper ways of discarding used tissues and instruct patient in differences between sterile, clean, dressing, bandages. It is imperative that disinfection and sterilization are performed precisely and effectively. Carelessness can cause a nosocomial infection in patients. A nosocomial infection is an infection that is acquired and originating in a hospital or, in this case, an ambulatory care facility. It's also very important to note that following these processes are to protect yourself and the patient. Please note any questions that you may have and bring them to class on Tuesday. Thank you.